Hello, I'm Marie, and welcome back to another episode of Moving the Needle series. And today I have with me a very special guest. Hello.
Welcome, thank you.
Would you want to introduce yourself?
Indranil, I'm the CEO and co-founder of Docquity. We are a startup registered here in Singapore, now in 7 countries, planning to go bigger.
Okay, maybe you want to let everyone know a little bit more about Docquity.
Sure, I think, we are a network of doctors. We started out as a platform with an objective of connecting doctors across different specializations and geographies. Started out in Indonesia, now expanded the network out to almost 7 countries, planning to go into a few countries more in the near future. But I think the focus of the company has been really, how do we really start to connect doctors for us to be able to drive these patient outcomes much better? That's the core objective, and I'm very proud to say that from day one till now, we have been very true to that mission.
All right. So what do the doctors do on your platform?
As a platform, we have 3 fundamental goals, like how can we help doctors learn continuously? How do we help doctors connect with each other, with different peers, and share their experiences? And finally, how do they really grow their practice? So it's an evolution which started from absolutely knowing nothing about, how doctors operate, to being a platform which is continuously evolving based on doctors' needs and time. I do believe that through the inclusion of technology, we have been able to help doctors find the right information when they need it, because I think that's a very important part of their professional jobs. And I'm sure that with the evolution of how the industry is going and how the doctors' needs are going, as a product evolution, I think we should be ramping up further.
I think just by hearing about what Docquity does, there's really a lot that you are doing. I think some of the few challenges I can imagine is, first, you're connecting doctors over many different countries, and there must be some kind of challenges in terms of like how different doctors operate in different locations, and also different specialties, right? Like there's a very big difference between how an ophthalmologist works versus, let's say, how a cardiologist works. So how do you put everything together?
See, I think before we go into the complexities of how the doctor world is different, we have to understand how the doctor world is similar, right? Fundamentals of that is the motivation for every doctor is to treat patients. And we know that a human body is not just one organ.
Yes.
It's a mixture, it's a combination of multiple different organs. And that's where I think where medical science is heading is how interdisciplinary, medical education can get. So I think that's the fundamental aspect. So instead of looking at how an doctor works, you can essentially go ahead and look at, how and what would be the other specialization that he would need to treat his patients better. I think that's the fundamental area that we are really trying to connect. And I think with medical science become more and more complicated, I think the experience sharing among these specialization is what is going to drive this interpersonal, interspecialization aspects, interdisciplinary aspects of the doctor. So I think if we focus on that, the regulations, the compliances, the requirements all come together anyway.
All right. So Docquity has been around for how many years now?
8.
Wow.
8, yeah.
Yeah. So how has it been like building this business up from scratch, and what are some of the challenges that you've been facing?
I think the first thing is, none of the founders, we have 3 founders, by the way, and we go back a long time, but all the founders are from telecom background. We have absolutely no relationship with healthcare. I think then when we started Docquity together, because of that need that we saw that we really needed to really connect doctors, the first problem was that, for 12 months, I remember, 2016, when we launched the product, there was not a single user on the application. 12 months, and we were thinking what was going wrong.
The onboarding process.
Yeah, exactly, because we thought we had a killer idea, but I don't think the doctors thought at that point in time. But one of our founders, I think Amit, he's a believer of really speaking and trying to understand those, those small little problems that come out. And we identified a problem around the digitization of continuing medical education for these doctors, for one of the medical associations, because the Indonesian Medical Association. But for 12 months, we didn't get a single user. But in one day, launching that CME course on diabetes, I still remember that, within 1 hour, we got about 1,000 odd doctors joining the platform.
Yeah, CME I think is one big gap that
It
many
is.
doctors require these points in order for them to continue their license.
I think it's not just about the points. We got to think about this from a bigger area, because many of the doctors in the main cities, like here in Singapore, I think it's a small kind of small setup. So doctors get an access to all the information. But think about the 1,100 islands in Indonesia, right? And that's where you have some doctors here, some doctors in one of those islands. How do you really get everybody on the same scale? I think that's what the digital CME approach that Docquity brought in really worked. And from there to now, we've probably driven almost around 6 million plus these credits that we have given to doctors.
Wow.
And that's one of the fundamental challenges. And the second challenge I think I still remember was it took us way too much time to fundraise. The reason is because I think the B2B side of business that Docquity is in, like doctor to doctor, was not very popular at that point in time. But once it broke through, some results came in. I think, as you've seen, you just completed our Series C 2022.
So since then, how has Docquity evolved from running these CME courses? What are some of your service offerings for your doctors?
Yeah, I think, when we started in Indonesia, we started out with CME, as I said. It took us, as I said, those 12 months to get to those 1,000 doctors. But from then to now, we are across, I think, Southeast Asia as a whole, 7 countries. But I think the fundamental, as I said, what we are really trying to do around those 3 pillars, which is learn, connect, and grow for the doctors. The evolution is really about how do we approach those 3 major pillars. I think learning, as we all know, we've all grown up from school and everything. Sometimes learning can get boring. So right now, I think where the Docquity application is focusing on is really about how to make learning fun and how do we make learning relevant, right? And that's a very important aspect as to how the evolution of the product is happening. And obviously, there's a lot of technologies, etc., data, insights, which is going through that product evolution. But like solving a problem around CME to a state here now that we are solving a problem of 400,000 plus doctors on the platform and helping them to reduce or find out, right kind of clinical information at the right point in time. I think that's the kind of evolution that the application has gone through. So I think, and it's not going to stop because the doctor's needs are, it's different in different countries. And I think from that perspective, we are also looking at quite a long-term goal from a company's perspective is to keep evolving ourselves as the way, the needs of the doctors are changing.
All right. Actually, I'm curious about this one. You're set on Indonesia, right? Maybe you can share some of the insights that you have from different markets. How has it been like for, I guess, the different needs of the doctors and how has this been overcome?
Again, rather than talking about the differences, again, you got to look at the commonalities, right? I think when we talk about commonalities, I think doctors, the fundamental need of having that information to be able to treat your patient better at that point in time, that is same across all the countries, right? I think where the differences lies is really about access to information. So let me give you, I was in Vietnam last week, and one of the things we found out that there were almost around, 60% of asthma cases in the provinces in Vietnam outside of Ho Chi Minh and Hanoi, which don't get diagnosed. Yeah, and when we found that information, this was like coming out from the doctors because there's the lack. It's not just a lack of doctor education; it's also a lack of patient understanding. The patient awareness. So the discussions with these doctors who were in these provinces, there's almost about 500 plus hospitals in these provinces. And the discussions with these doctors was how do we leverage the education and the experiences of these doctors to be able to get that information out to patients even more. And now we are working on an aspect with these hospitals and these doctors, like how do we help create patient communication aspects, for these doctors in the region, which is very locally centric to Vietnam and the Vietnam's provinces. So again, if you boil it all down, the commonality is still that doctors are solving that problem, but the way to approach that problem, I think that is what is differing amongst the whole countries, and that's beautiful to see because that keeps us awake at night as well.
Right. So with Docquity expanding into all these different markets, right? What are some of the logistical challenges in terms of, like, let's say, approvals or licensing in all these different markets?
Yeah, that's a good question. I think generally, if you look at most of the countries have their own PDPA laws, like personal data security. I forgot the full form, but it's like personal data security. And each of the countries have some kind of regulations and specificities that we have to really consider.
For the healthcare,
because it's healthcare, as I said, right? It's quite. I think the broad purpose of these regulations are very, very important because these are patient data and conversations that we are talking about. And Docquity had to adapt a lot of these things, for us to be able to move forward in each of these countries. But while we are looking at these, the local compliances, we are also looking at what internationally is happening. So one of the things that we did was we got ourselves GDPR compliant. Very important. There was another regulation which was around the HIPAA compliance, which governs, how the doctors communicate amongst each other, and we got that thing covered as well. And what we are essentially seeing now, that is helping us to be able to launch more countries faster, because now we can take a variant of that and we apply into the local countries. So yeah, I think that's a very fundamental aspect of the business that we are learning, on a day-to-day basis. But I think it's all for the better, because if you have to be in the health tech, you've got to be really compliant around it.
So in terms of expansion plans, right? Because now you've got over 400,000 doctors on the platform. What are your goals and what are your expansion plans for the future?
Again, two ways to answer this. From an investor's perspective, we are looking at, of course, we are trying to look at different markets. We've just launched Taiwan. In fact, this month we actually launched Mexico.
Oh.
And we got, first day we got about 30 doctors joining in, so yeah, good start. There are some additional markets we're looking at, maybe Japan is one of them. But again, fundamentally, when we start to look at this expansion from a broad-based perspective, I think the objective is, instead of looking at this market by market, how do we look at what are the problems that we could solve for our doctors globally that will help us to become market relevant, right? I think that's fundamentally where Docquity is really trying to look at. We have identified search as a very big issue within clinical research that these doctors are doing, and we're working out on a product. Hopefully it will get launched very quickly. We're actually working on a product where we can actually make search very local and very relevant for these doctors, and they could find that right information at a very quick piece of time. So I think that's where we are trying to look at. It's not just a market by market expansion. It's really about creating use cases which is globally relevant, so that hopefully one day the world becomes our market.
So a lot of the work that Docquity does is with the healthcare professionals, like in the CME talks and the services. So I understand that there was some discussion about how you're creating patient materials to help the local population in Vietnam. So how do you see Docquity eventually translating down to patient care and like the patient outcomes?
I think to answer that thing a little more personally, I'll take you back to actually the founding story of Docquity. It was actually a phone call between two doctors that saved my dad's life, one doctor in Delhi and one doctor in Santa Clara. It was a conversation between two doctors. The experience was shared. And the doctor in Delhi did that for my dad, and he was able to live another 6 years. Essentially, where that real impact came in was my dad was able to see his grandchildren, right? So I think it is very hard to measure quantitatively as to how these interactions between doctors are really helping patients, and that has been one of the can't say a flag, but it has always been one of the challenges that we have seen. How do we really measure what we set out to do? So very recently we have actually started working on another platform, which is all around patient adherence and patient affordability and patient access, primarily leveraging the community of doctors that we have built out. And I think it was public news that for breast cancer patients in the Philippines, you were actually able to get medication, and we were able to kind of help the patients save almost $1 million over a period of year. So that's another way where we are trying to, now that we can measure, right? And we are actually seeing that the community of doctors, of the experiences, and bringing towards the ecosystem of the doctors, the patients, the pharmacists, and the industry together, we are able to solve those three problems that every single patient, I think, in developing country faces, which is really about access, affordability, and adherence. So I think if we can measure that, and we've just started that business, it's just about 1.5 years old right now, I think we should be able to get some more quantitative data out of it.
All right, just to close off this interview, maybe you want to share some thoughts about how Docquity has come, and maybe you want to give a statement to these doctors about what's so important about this app that they should come and join us.
Yeah, I think the fundamental, again, that I said was we are here for doctors. We are an application which is being built for doctors. It's been built around doctors, and our product evolution is all for doctors, right? From our perspective, we are here to help doctors get better every single day, and better in the terms of how they are delivering patient care, whatever iota we can help them. So I think the objective from all doctors, from our perspective, is that we are a startup. We are evolving. We have not learned every aspect of how we can help you, but I think the more and more feedback you give us, the more better we will be, because that's our commitment to what we can offer. How do we really help doctors get better in delivering patient care every single day?
All right. Thank you so much, Indranil, for coming here.
Sure.
And for sharing your story, and for sharing about Docquity.
Perfect.
Right. So
thank you so much.
Thank you. Yeah. So this is another episode of Moving the Needle series. I'll see you next time. Bye-bye.